Macroanatomy of the heart. Imagine this. You're working in a hospital and a 54-year-old man is rushed in. He clutches his chest, his face pale with pain. He has already taken a nitroglycerin pill, but the pain won't go away. You check the ECG and see some unusual changes. What's happening? What should you do next? This patient is likely having a heart attack. A blocked artery is cutting off oxygen to his heart. But where exactly is the blockage? How dangerous is it? Which areas of the heart are at risk? The answers to these questions depend on heart anatomy. Today, we'll explore how the heart is built, how it receives blood, and why this knowledge is critical in medicine. Where is the heart located, and why does it matter? The heart sits roughly in the center of the chest, slightly tilted to the left. It is protected by the ribs but is still vulnerable. Why is this important? In car accidents or trauma, the front part of the heart is most at risk since it is closest to the surface. In cases of fluid buildup around the heart, cardiac tamponade, doctors need to know the safest spot to insert a needle and drain the fluid to save the patient. Knowing the heart's location also helps in routine care, like positioning a stethoscope correctly to listen to heart sounds. Heart chambers. What does each one do? The heart isn't just a muscle, it's a sophisticated pump with 4 chambers. 2 receive blood and 2 push it forward. How does it work? The right atrium collects oxygen-depleted blood returning from the body. The right ventricle sends this blood to the lungs to pick up oxygen. The left atrium receives oxygen-rich blood from the lungs. The left ventricle pumps it out to the entire body. Why does this matter? If the right ventricle weakens, fluid backs up in the veins, causing leg swelling. If the left ventricle fails, the body lacks oxygen, leading to shortness of breath. Doctors can use these symptoms to determine which part of the heart is malfunctioning. Heart valves. How do they work? Heart valves act like doors that direct blood flow and prevent it from moving backward. If they fail, the heart can't effectively pump blood. There are 2 types of valves, between the atria and ventricles. They open to let blood move downward. And at the exits of the ventricles, these open when the heart pumps blood into the lungs and the rest of the body. Why does this matter? If a valve is too tight, stenosis, the heart has to work harder to push blood through. If a valve leaks, insufficiency, blood flows backward, causing the heart to work twice as hard. Real-life case. A patient complains of dizziness and fatigue. You use a stethoscope and hear an unusual heart murmur. This could indicate a valve problem. If untreated, the heart may fail over time. Heart's blood supply. What causes heart attacks? The heart isn't just a pump, it also needs oxygen. Coronary arteries are like special pipelines that supply the heart muscle with nutrients. The 2 main arteries are left coronary artery, it supplies the front and side of the heart, and right coronary artery, which supplies the back and lower parts of the heart. How does this relate to heart attacks? If the left coronary artery is blocked, the front of the heart is at risk. This is one of the most dangerous types of heart attacks. If the right coronary artery is blocked, it can cause dangerous rhythm problems because it supplies the areas that control heartbeat. How do doctors detect blockages? ECG shows which part of the heart is affected. Angiography reveals which artery is blocked, so doctors can insert a stent and restore blood flow immediately. When a patient arrives with chest pain, doctors first determine which artery is blocked. This guides the entire treatment. Today, we've learned how heart anatomy helps doctors make life-saving decisions. Knowing the heart's location helps diagnose trauma injuries. Understanding heart chambers allows doctors to recognize heart failure symptoms. Listening to valves helps detect heart diseases before they worsen. Identifying blood supply problems helps diagnose heart attacks within seconds. Now imagine you're a doctor. A patient arrives with chest pain. You must act fast. These anatomical insights are your most powerful tool. Are you ready? You will have a variety of diagnostic tools for your future practice. Electrocardiography, which quickly detects signs of a heart attack. Echocardiography, echo, which shows how the heart chambers and valves function. And computed tomography, CT, angiography, which visualizes narrowed arteries. Next time you hear your heartbeat, remember, it's not just a rhythm, it's a complex system working every second to keep you alive. This knowledge isn't just theory, it saves lives.